Hi, this is Maureen Ryan doing a short presentation on foot conditions. Some of the sources of information came from a variety of sources. One was from WebMD, a slideshow, as well as some information from NIH. This is the beautiful Hawaii. I'm going to tell you the story of how I broke my foot the first day I was at a conference. I was walking, not noticing where I went, and I had inversion type of injury. And immediately I had swelling right in this area. You can see within a couple of hours I was getting bruising. Again, this is after actually a couple of days. If you notice, I have redness because of the ice that I was putting on. And again, this is a good thing to look at because patients will often come back and say, well, my redness was here, but now I've got all this bruising here. And again, with the fracture, you get contusion, red blood cells, they settle dependently, and that's why you have what looks like the extension. If you can notice, again, I was up and walking because I wasn't going to miss Hawaii with a flat shoe. And so if you notice, the bruising did go into other places. And again, it was quite painful right in this area. When I came back, I had an x-ray and wore a flat shoe. These are bunions. This can be due to shoes, but there's also a genetic predisposition. What happens is that you get weakness of the ligament, so it turns, and this can cause pain right in this area, and sometimes that there is a need to go ahead and have surgery. I have these, and orthopedic doctor once told me if I can make it to 65, I can wear flippers for the rest of my life and not need surgery. Here's corns and calluses. This is a big deal for a lot of our patients because they'll get really very thick corns and calluses. And it usually is friction. We're going to be looking at getting better fitting shoes. You can go ahead and shave these down or then put pads into the shoe itself. Plantar fasciitis is a very common problem in primary care. It causes heel pain. They'll have pain right as you push up on that heel. It is the flat band of tissue that runs the whole area of the sole of the foot, and it will hurt more in the morning. A lot of people, it's extremely painful. They sometimes will wind up on crutches, and it hurts, again, less during the day, more in the morning. And this can take months to resolve. Some people have faster. Gout, acute gout, what you will see is redness at a joint. People tend to have their favorite place. Most often it is on the first metacarpal on the foot. And as you see, you'll see redness. Ask the patient as far as if they have a history, because sometimes you can say, oh, is this a cellulitis? They're going to be very tender. I usually do get an x-ray to rule out some type of fracture. You can go ahead and do a blood test for crystals, but what happens is that they may, as they go into the joint, you may have a decreased amount in the blood itself. For people who have acute gout, without treatment for years and years, they can cause eating away of the bone. Plantar warts, everyone sees these. On the sole of the foot, they hurt like heck. And again, it's just one of the common viruses, and they are very contagious. That's why one of the reasons we tell people to wear the flippers, the rubber shoes when they go into a shower area. And they're harmless. About 50% will resolve on their own. Some will go somewhat deeper. You can use things such as the dry ice, nitrogen to get them out. But the big thing is to try to resolve it. You can put even duct tape, but to treat the underlying pain. Athlete's foot, this is very common in young adolescent males, and it can be a very chronic infection. It is a fungal infection. And it can get very bad, peeling, redness, itching. If you've ever seen some people in the street, people, bless their souls, that come in with chronically wet feet, they can have this all over, and it itches, and it's painful. And you can catch it even from taking a shower after someone has it. You can use the topical antifungal lotions like the Lotrimin, or if it's really bad, you can go to Griseofulton. I'm pronouncing that incorrectly, but there is an oral medication. Sometimes it will get so bad it will cause a cellulitis. Now, if you see this, some people might treat this just with topical antifungal. I probably, depending on the history of the patient and other factors, might put this patient on an antibiotic. And the reason being, if you notice they have a fungus in the toes, there's enough redness, and I would be concerned about this as well. So I would check to see if there's any lymphatic streaking, if we have any enlarged lymph nodes in the femoral area, and how much this is affecting the activities of daily living. Have them put the Lotrimin, but I'd also put clean white socks, daily foot care, and probably put them on an antibiotic such as Keflex. Toenails. You've all seen this. It increases with elderly people. It's a chronic fungal infection. It can be treated. It tends to come back, particularly with older people who are getting thicker nails. It can cause thickening of the nails to make it to the point that it's very hard to cut the nails. I gave my father, in fact, some trauma scissors, and he thought it was the best gift he ever got. They do have a nail paint that you can put on it. Antifungal pills, the problem is it tends to come back. This is a hammer toe. If you notice that there's a defect, this is from a ligament problem. Again, it's from tight footwear, and it's going to be usually the middle joint. Well-fitting footwear, I tend to tape that. I have a little one when I go running. I see this a lot, the ingrown toenail, and it grows into the skin. They can have redness. It hurts a lot. They can get a cellulitis, but a lot of times they'll come in with a lot of redness, and it's just really a foreign body reaction. What you can do is go ahead and give a digital block, clean the nail, and you actually cut down to the beginning or proximal part of the nail bed and clip it. Actually take it off so that when it grows back it can grow in properly. Flat foot, when someone comes in with a pain in the foot, always look and see what that arch is looking like. It's going to be completely flat. It can be inherited. Some people, it will hurt. They still will not take you into the army.